Hi, I'm Phil Provenzano, the owner and founder and head coach of Team Provo LLC. Today we're going to talk about a taboo subject, testosterone. The benefits of testosterone on one's physique are quite great, actually. Increased muscularity, increased strength, better pumps, better stamina in the gym, decreased abdominal fat storage. If you notice on older men, most of their body fat accumulates below their belly button. Almost always, if someone has all their fat accumulating here but not as much elsewhere, that's a lot of times the cause is low testosterone. More efficient storage of glycogen, better nitrogen retention, better muscle fullness, increased vitality, better sense of well-being, better sleep, decreased anxiety. Sometimes people are depressed because of their low testosterone levels, and this helps bring it up. A lot of doctors like to say that when a patient comes to them asking about testosterone treatment to treat their low levels, they try to scare them away, saying things like it's going to cause liver cancer, or it's going to totally mess up your cholesterol and raise your blood pressure. And in some cases, and with abuse, this could be true. I found with blood pressure, I found studies that actually show that at the right dosages, testosterone could soothe the blood vessels, making them more elastic, easier for blood to flow through them instead of constricting so tight like with someone that has high blood pressure. Obviously, if someone's using more than a therapeutic dose, there's a good chance they're going to retain water and thus increase blood pressure. So we're talking mainly from a therapeutic medical standpoint, but it could actually have anti-hypertensive properties. The myth of it destroying your cholesterol, the only time I had slightly bad cholesterol was when my testosterone levels were very low. But genetically, I have very good cholesterol, and I had low testosterone at the time. It was the first time my LDL was ever over 100. And after treating my low testosterone levels, my LDL dropped down to 60, and my LDL was well over 50 still. So I guess maybe in some people that have a predisposition, but in many healthy males, using the right dosages could actually improve their lipid profile. Prostate, this is something that is genetic and needs to be watched. It could cause some prostate enlargement. So that's something that would need to be monitored. All these things would need to be monitored by a medical professional. But liver cancer or liver failure, generally speaking, testosterone is not liver toxic. I've seen many times, like a natural guy has low testosterone and he says, oh, I'm mentally tougher, I'm going to beat it. And that's great. If you have a normal testosterone level and you want to achieve things, with no medicine of any kind, that's great. Go for the goals. If you're smart about it, you can get it. But if you're fighting low testosterone, you're really spinning your wheels. It's almost like the more effort you put into it, the worse you're going to break your body down. The harder you diet, the slower the fat comes off. The harder you train, the more your muscles flatten out. You're really fighting nature here. And I think unless you're really an anomaly, and like more than 9 times out of 10 with low testosterone, if you're really doing an extreme physique enhancement, training, eating, it's actually that lifestyle may prove more detrimental to your testosterone profile and your physique. So you would really need to scale things back and play with it. The efforts could prove to be futile. And a normal non-competitor, you might say someone over 30, they say every year their testosterone may decline by a certain percent, and that might be true. But people doing physique enhancement, like physique sports, this can happen a lot sooner because, dieting to extreme low levels of body fat like we do to get on stage, this can cause in itself our testosterone levels to decline. In many young healthy males it bounces back, but a lot of times it doesn't. So when a patient goes to a doctor and explains this, they automatically brush them off and say, you're too young, there's no way you have low testosterone. Well, you have the right to know. You should get the test done. If the doctor won't do it, you should go to another one. And maybe hormone replacement isn't the answer. Maybe there's a way to get it back up, but the issue needs to be addressed. You don't want to, as a young man, be walking around with low testosterone, depression, low sex drive. It's no way to go through your life. So whatever way you're going to treat it, whether it's getting your levels back up naturally or medication, it's something that needs to be addressed at all ages if you're experiencing those symptoms. Well, there's a couple of ways we can go. The first plan of attack would be to examine your supplement arsenal. I buy all my supplements from Nutley Nutrition Zone from my good friend John Hala on Franklin Avenue in Nutley. A first good step would be this D-aspartic acid. D-aspartic acid is an amino acid that has proven to raise blood testosterone levels. When I was dealing with low testosterone, I actually went this route first. Although I wasn't able to restore my levels super high, this actually raised mine 150 nanograms per deciliter in 2 weeks' time. I was pretty impressed with that, so I really do stand by this product. All my natural athletes and my older clients who don't use testosterone replacement therapy use it, and they do. The large majority are very pleased with it. Tribulus, this is an old supplement, but it does have some relevance. It increases and stimulates our luteinizing hormone, which signals to the pituitary gland to produce more natural testosterone. So Tribulus is definitely a good supplement to have in your arsenal. And this halotropin here is also a designer supplement by ProSups. Well, when raising testosterone, you need to think of a couple different avenues. It's not so simple as just raise testosterone. You need to both, because your body's constantly trying to have a balance of its hormones. So by bringing your estrogen down, you could actually raise your testosterone. And same with DHT. So this supplement has agents in it, saw palmetto, which helps block the conversion of DHT, and it also blocks the conversion of testosterone to estrogen. So I mean, this would be attacking it from 3 different avenues. Would be a good plan of attack. There's also things you could do with your diet. Increasing healthy fats can increase testosterone levels. If the cause of your low testosterone is too much exercise, you might want to consider scaling it back. For some people, low testosterone may be from being too overweight and their estrogen levels are high, so their testosterone levels are low. So in that case, losing the weight could help improve it. In the case of someone who's not exercising at all, doing compound movements like squats and bench press and deadlifts, studies have also shown that can raise testosterone levels as well.